If you believe in public education and want to support the teachers of our community, join us at Foundation 65's annual My 65 benefit on October 6th. Learn how educators create grants that transform the lives of their students. Visit foundation65.org to learn more and register today.
Welcome to Inside the Skev, and I'm your host, Aaron Masliansky. Today we are here with Dr. Judith Glassenberg. Judith is a pediatrician and the co-site medical director with Erie Evanston Skokie Health and Dental Center. She has been with them since 2013, and Judith recently traveled to Poland to help the Ukrainian War refugees and has also helped many of the migrants who've recently arrived here in Chicago. And we're going to talk about that today. We're going to talk about Erie. And Judith, thank you so much for joining us.
Thank you for having me.
Yeah, it's great to finally have you here. And, you're very far away from where I live. You're just a few houses down. So we're the Lincolnwood drivers. And it's just so great to be able to speak with you because I think what you do is so interesting and it's so appropriate to what this show is all about, which is about Skokie and Evanston, and also showing how this community is connected globally to so many different places around the world. And even within this past year, you're a clear example of it. So how did you get involved in medicine in the first place? What brought you to this career?
When I was in high school, my senior year, we took one of those aptitude tests, and it told me that I would be good at science and also people. So that pulled me away from what I had been thinking about until that time, which was archaeology.
That's a little different. And made me sort of think about some other things. I went through college at the Jewish Theological Seminary and at Barnard in New York. And I was presented with the opportunity to apply to medical school without taking the MCATs. How's that possible?
Mount Sinai School of Medicine in New York at that time, and they still do, had a program called Humanities in Medicine, where they were trying to facilitate the attendance in medical school by people who weren't just focused on the basic sciences in college, right? Normally pre-meds take all this organic chemistry and physics, and they spend a lot of time studying for the MCATs. And their thought was that more diversely exposed students would make excellent doctors. And the way that they facilitated that was by allowing them time in college in their undergraduate years to take other kinds of classes. So I applied, and I got in.
Were you taking archaeology classes before that too, or no, because that was what you were just thinking about in college? I'm sorry, in high school.
In high school. So I applied as a sophomore. So I was even still just taking all of the, JTS had their requirements, Barnard had requirements. So I was really doing a lot of the sort of required courses. It was a program where I was doing 2 BAs in 4 years. So a lot of my elective time at Barnard was really accounted for by some of the classes that I was taking at JTS. So I was just sort of studying everything, right? I was taking music classes. I was taking Bible and Talmud classes. I was taking Jewish history classes and sociology classes and some of the core curriculum that Columbia University offers. So I was really enjoying college.
Oh, yeah.
And I got to keep enjoying college because I didn't have to take physics, which was awesome.
Yes. So then you started into the medical school and you got into your career, and then you landed on pediatrics.
Yes. So I, from the very beginning in medical school, was interested in primary care. I really liked the idea of meeting patients and getting to stay their doctor and not addressing one focused issue and then sending them on their way. So initially I was interested, I was thinking about family medicine. And then I realized that, at least in my opinion, kids are so much more fun than adults. Kids, even when they're sick, if you make them feel better, even for a few hours with some Tylenol, they want to play and draw and laugh and find things diverting. Adults, when they're sick, we're sick and we don't feel good.
Yeah.
And we don't want to have fun. Kids are also, for me, again, the pathology that kids have is really interesting because it's different ways that something that almost always goes right, but has so many components. Fetal development sometimes goes wrong. And it's interesting the ways that it goes wrong, purely from a scientific perspective. And understanding that allows us to help the families of those kids where things have not gone exactly right, to support those kids and treat them. And I also still really got the sort of treating the whole family part of it in pediatrics, because kids don't exist on their own. They exist within families. So that's really what drew me to pediatrics.
So then you could see the whole picture, and you're there at the beginning as well of their lives. So you really can have more of an impact. What led you to work at a place like Erie?
So I did my residency at Jacobi Medical Center in the Bronx, which is in a part of the Bronx where there's a huge working class community and a huge community of working poor, right? People who are working really, really hard, but at jobs that don't allow them to make enough money to only work one job, for example, or to pay for tremendous amounts of outside of school hours childcare. And that felt very meaningful to me, right? I felt like I was making a difference for families and really providing quality medical care that everybody deserves, and doing it for families who didn't have other options. Erie is, as a federally qualified medical center, is serving some of the same patients. And what I particularly liked about the Evanston location, where I have the privilege to work, is that it's the community that I live in. Mm-hmm. So I am treating my neighbors. I'm treating the families that my friends' kids are in school with, or that my kids play baseball with, or that I see at the grocery store. And I am providing what I would like to believe is very high quality medical care, again, for people who don't have every other option available to them.
Right. I mean, tell us a little bit about, for the audience who aren't familiar with Erie, I mean, how did it start, and, what does it consist of now as a, I know that it has a location in Evanston, but I mean, it's much larger than that.
Yeah. So Erie has been around for many, many years. It started as a health center. It's called Erie Family Health Center because it started on Erie Street in Chicago. That's where the first office was. And over the last, at this point, it's more than 40 years that Erie has been around. We have more than 10 offices in Chicagoland, and we serve 80,000 patients.
Wow.
Among those different offices. So we have offices in Humboldt Park. We have an office near Swedish Covenant Hospital. We have our office in Evanston. We have an office in Waukegan. We have a number of school-based health centers that we staff as well. So kids and their families can come in and get care at the school, which is super convenient for them. It's almost exactly 10 years ago that the Evanston community with North Shore Hospital and the government of Evanston approached Erie about opening a clinic in Evanston because there was a need that wasn't being met. We spent the first year operating out of the lower level of the Evanston Civic Center. And then in November of 2013, the office on Dempster opened.
So when you came, were you just at the office on Dempster, or did you start actually before that at City Hall?
So I started in the basement, the lower level. I was there for a number of sessions. I started only about 2 months before the office on Dempster opened with Erie. So I didn't spend a lot of time there, but certainly sometimes. And I still have some patients who come to see me at the Dempster office who were the first babies that I saw at the lower level civic center.
That's pretty cool. And the center in Evanston, I mean, it's grown a lot. It's not just you opened up in a smaller space, and then it's expanded throughout the building, right?
That's correct. So when we opened, we had 17 exam rooms, which is still a pretty big clinic, right? I mean, if you think about what sort of your typical private doctor's office has, they have 6 or 8 exam rooms that they're working out of. So 17 is still a pretty robust clinic size. We have providers who treat the entire lifespan at Erie Family Health Center, which is one of really the amazing things about it. So you can be a kid who's seen by a pediatrician, age up to a family doctor or an internist, get pregnant, have a be cared for while you're pregnant, have the baby be delivered by your doctors from Erie Family Health Center at one of our partner hospitals, and then bring your baby back to see a pediatrician.
Wow.
So we started with 17 exam rooms so that we had space for all those different kinds of medical providers to operate. And then 3 years ago now, or a little more than 3 years ago, the family medicine residency of North Shore University Health System moved in. And so now we are their primary care home where they see patients as they're learning to be family medicine doctors. So we now have 34 exam rooms. We doubled in size when they joined us, and took over another big chunk of the building that we operate out of.
And you also have dental care?
That's right. Evanston, I believe, has 5 dental chairs. So we have a number of dentists who are there, and all of our children are able to see the dentist there, and we have access for a number of adults, pregnant women as well.
And you take people, any type of insurance, or people who don't have insurance?
So we are primarily exist to provide a safety net option for people with public insurance types, but we are also in network for all PPOs. So one other fabulous component is that we can see patients who don't have insurance with a sliding fee scale. We can see patients when, during a season of time that they qualify, for example, for a public option. We can keep patients if they're then employed and have an employer-sponsored plan that offers a PPO. And then if that employment situation changes and their insurance either is gone or reverts back to a public option, we can keep them. So we are really able to stay with our patients as their circumstances change.
I mean, I think that's so important that people are able to stay with their doctors and continue that, because that's been a lot of the push for improved medical care, is that you got to pick a primary care physician, because that way you're not just going to the emergency room anytime you have something going on. You can call your doctor, and then maybe there's other avenues that are more appropriate and more affordable than just having to go to the hospital immediately.
Absolutely. One of the other really amazing things about Erie is that we have a really robust behavioral health team. So we have therapists in each of our offices, and we have, I think it's now an 8 psychiatrist team that provides psychiatric services as well. So it's really in many, many ways a full wraparound location, so that people can really come and get a lot of their needs met in one office.
Do you have social workers too?
We have caseworkers. So there are a number of different organizations or a number of different categories of patients who qualify for our case management services. All children up to age 1 qualify, pregnant women qualify, and then there are a number of other categories depending on patient need and insurance status in addition.
Where's most of your funding from? Is it mostly from the payments from the patients or insurance or Medicaid, or is it funded through different donors and things like that?
So I can't speak to most of. I know that we certainly get payments from insurance companies, but we get, as a federally qualified health center, we get a lot of funding from the federal government. Mm-hmm. And we have a number of grants and donations that are also help us keep the doors open.
It's so important. And I mean, we've gone through the past couple of years of all this COVID stuff, and we've had plenty of conversations about it. And I think that you guys opened up for kids to come in and get vaccines. Didn't matter if you're a patient of Erie. Just really trying to educate the public on how to keep themselves safe and healthy. I think that's been an important part as being part of the community, wouldn't you say?
Absolutely. I think that is one of the really special things about our Evanston office in particular, is that a lot of our doctors live in the local community. As I tell people all the time, when we received our the COVID vaccines for the 5 to 11-year-olds, the 5 to 11-year-old children of the doctors in the office were there on the first day to get our vaccines, or get our kids their vaccines. We live here, we're part of the community, and we appreciate what Erie Family Health Center brings to the community for our families in addition to working there.
Yeah, I do too. I mean, I brought my kids there for their first shots, so that was really, really important. And I mean, you're a pediatrician, you're steeped in medicine, but you help manage this facility. You're the co-site medical director. I mean, what is that like, having to manage everything that's going on?
So Erie does a great job of allowing people to sort of work in their scope by providing some pretty significant operations support. So I do manage the medical side of the clinic along with one of my family medicine colleagues, but we have an operations partner with whom we work very, very closely, and it's really it allows me to think on sort of a more population-based level about a lot of things, which is engaging and challenging in a whole different way from treating individual patients. So I really appreciate that, because it means that I can think about things like, how can we promote vaccination for regular childhood vaccinations in addition to flu vaccine and COVID vaccine among our patients, not just how do I have that individual conversation with parents when I'm seeing patients in an exam room, or how can we improve our cervical cancer screening rates or our colon cancer screening rates, or the control of hypertension among our adult patients. And I appreciate that variety and the ability to sort of have different things that I'm thinking about over the course of the week, in addition to the pleasure and challenge of treating patients directly.
Let's take a quick break to hear from our supporters. When it comes to home warranties, getting the best contractor can be tough. That is because traditional companies limit your choices. Achosa Home Warranty has the answer. Achosa Home Warranty believes that homeowners should be empowered to choose their own licensed technician for each repair or replacement project. When you select Achosa, you're ensured to prompt, reliable work to restore your home. As one of the country's leading home warranty companies, Achosa has set the industry standard for their positive customer claims process and performance. Reach out to Kim Bazillion at 847-975-6706 and mention Skev50 for $50 off their Advantage or Advantage Plus plans. They look forward to protecting your budgets against costly repairs or replacements.
Moving day is a happy day, but how can you be sure all of your stuff will get to the new place in the same condition they left the old place? Upgrade your experience to First Class Moving and Storage. You'll get a team of professionals who treat all of your belongings with care and have the right tools to make the job go smoothly. They even offer a full packing service. Upgrade to First Class Moving and Storage. They're local and independently owned. For more info, visit the website at firstclassmovers.com. That's the number 1, stclassmovers.com.
Well, in addition to this, I mean, you've been up to a lot of different things this year that don't just pertain to Erie, but do connect with Erie. Earlier, you went to Poland and you were helping Ukrainian war refugees. How did you get involved in that? What led you to provide that type of service, and what was it like?
My parents very explicitly raised my sister and me to believe that we have a responsibility to help other people. So as I've gotten to a stage of life where I haven't been, pregnant or nursing a baby or trying to figure out how to add children to our family in a way that is sustainable, I have really been seeking out those opportunities because I feel like I don't know if it's more than it used to be when in other generations, but I feel the sort of the call to help. I have this amazing education and a skill set that is useful in a lot of settings where people are suffering. So when children were being held in fenced cages at the country's southern border, I tried to figure out how to get to Texas to help those kids, and unfortunately wasn't really able to figure that out when thousands of people were fleeing Afghanistan. I reached out to the teams that were working at the armed forces bases where they were being housed temporarily to try and help there, and that didn't work out. So when our friends in the Skokie community figured out how to go and help provide medical care at this refugee center, I reached out to that organization, to Natan, which is an Israeli disaster relief organization, and was able to sign up to go.
Wow.
Yeah. I think it definitely says something about the Skevinston community that of all of the doctors that this organization deployed to the Poland-Ukraine border, 3 of them live in Skevinston.
That's true.
It's an Israeli organization, and three of their doctors live in Skevinston.
That is really interesting. Do they get people from all around the world though who are going there? I mean, is it still open? I assume so.
So they actually just shut down the operation.
Okay.
The number of doctors coming, the number of refugees coming through has really changed, and the flow of people in that particular part has changed. So the operation just closed. I was there. News. Yes, definitely. I was there the end of May, beginning of June, and we're now recording mid-September. So it's been, probably 6 months that they've been operating.
What was it like working? I mean, I imagine you weren't just working with kids. You were working with anybody who came through there, right?
Correct. That was startling to me. I imagined that, to myself, not based necessarily on anyone's statements, that there would be lots of women and children coming through, and that therefore a pediatrician in particular would be useful. But in fact, though there were lots of children, it was in the adults who were more impacted by the stress and anxiety of having to uproot their families and leave their homes because of the war, and the adults with the chronic medical conditions that either they'd run out of the medication to treat, or they weren't exactly sure how to continue treating, or they needed help managing as they were in transit.
You know, do you know how to speak Ukrainian or Russian?
I do not.
So how did you communicate with these people?
So the non-doctor team, Natan very deliberately sends doctors, nurses, and then social workers. That's their focus, so that they're able to provide psychosocial support in addition to medical care on all of their all of their delegations to all the different places around the world. They send teams. All of the non-doctors. So we had 1 nurse and 4 social workers. Actually, 3 social workers and 1 occupational therapist. They were all Israeli and all actually native Russian speakers. They were people who had made Aliyah as children from the former Soviet Union. So they operated as translators for us. There was also a tremendous number of other people there volunteering, people who had felt called to help. So it was funny because sometimes I responded to my translator in the wrong language, right? I had some people translating for me from Russian to Hebrew, and I had some people translating for me from Russian to English. And I definitely went back to the English translators with Hebrew sometimes, and to the Hebrew translators with English sometimes. And it was there were a lot of people helping, but it was a lot of different languages.
Yeah, it's like the United Nations.
Well, it really was, because there were organizations from so many countries represented at this refugee center and at the nearest border crossing in Medica. I mean, there were expats from China, there were people from India, there were people from Pakistan, there were people from Egypt, there were, organizations from all over the world who and certainly other American and Canadian, British organizations, and a number of other countries represented at this refugee center where people could go. They were absorbing refugees on a temporary basis so that people had a safe place to stay. So there were lots of languages represented. One of the amazing advantages I had coming from Erie Family Health Center is that I speak Spanish and can provide medical care in Spanish, because a number, I would say probably 40% of our patients are primarily Spanish speaking. So there were a number of Spanish volunteers who could speak Russian and Spanish. So there were even a couple of times where I had someone translating from Russian to Spanish in the clinic at the refugee center.
That's amazing. I mean, and it's something I haven't really heard about much in the media, about how many other countries have been involved with trying to provide humanitarian services for the victims of this war. And it's incredible that you're able to, it's like a Rosetta Stone of trying to figure out what everyone's saying. It's
absolutely true.
Yeah. I mean, how has that impacted you, that experience there? What do you bring back to your life here in the Skev?
I think I feel generally better about humanity because there were so many people there helping. It was really an impressive outpouring of people coming to provide support to these refugees. I also, it made me really appreciate the work that I'm able to do at Erie, because though there isn't a hot war happening here, there are a lot of stressors, especially coming out of the pandemic, that really put more stress on a lot of families, right? People losing jobs, childcare not available, intermittent shutdown of schools and daycare facilities because of COVID cases. People don't have enough food here. They sometimes can't afford their medications here. So it really made me appreciate the crossover between stressors. There are a lot of different things that can cause stress, and that stress can impact people's well-being and their health in very similar ways, independent of what the original stressor is. So I really appreciated, I mean, there, right, people were at this refugee center for 48 to 72 hours, right? I didn't have long-term interactions with any of them. And it made me appreciate the fact that I can have those long-term interactions with my patients here, so that in addition to making sure they have their blood pressure medications, though I don't do that with my patients, or treating their dental infections, or giving them, medications that here are available over the counter for upper respiratory infections, to treat those symptoms. In addition to meeting those like very immediate needs, I also have the opportunity to help address some of the effects, the longer term effects of the stressors in their lives.
And you're dealing with people who may have uprooted their lives and come from different locations and now settled in this area.
Absolutely right. So we have a very high percentage of our patient population where the parents, at least, I mean, a lot of my patients are born here because I get them as newborns, but the parents were not born in the United States. So that you're right, that is a pretty significant similarity.
Yeah, it definitely is. I mean, and right now, there have been a lot of migrants who have been bused to Chicago or other places throughout the country. It's a political hot button. But you recently went down to help busloads of migrants who came to Chicago. Is that right?
That's right. So 2 weeks ago, I got to be part of Chicago's response when these two busloads of migrants, mostly from Venezuela, arrived in Chicago on a Wednesday night, mostly unannounced. Erie Family Health Center, along with other organizations in Chicago, mounted basically overnight, not basically, quite literally overnight, this tremendous response to welcome them and get them settled. We went down to the Welcome Center that Chicago set up. The truth is, I felt very similarly impressed by the number of organizations and the number of people who just showed up to help that I saw at the Welcome Center in Chicago and at this refugee center and at the border crossing in Poland. People want to help, and it was really very, very moving. We provided medical screening exams to all of the migrants. Erie Family Health Center managed one bus, and one of the other federally qualified health centers in Chicagoland, Esperanza, managed the morning bus. And we got people set up with follow-up appointments who needed additional medical care at our clinic. And a number of them even went from our first clinic in Westtown to one of our other offices where there was dental availability to get their dental issues managed. I mean, these are people who've been traveling for months, and they had some pretty significant medical needs.
Are they being settled now into housing?
They are. I think that's something that there are different organizations helping with. There are some people in shelters, some people in other settings.
It's uplifting in a way to just see how people from all around the world there's just a segment of people like yourself who are ready to rush to help, and I mentioned it's a political hot button, but the fact of the matter is that there are bad situations throughout the world, even here in Chicago. And the only way to address it is not to ignore it, it's to help. And if you could help the right way, these people are going to be productive members of our society if we do it the right way and give people opportunity and treat, medical issues that they may have and get them set up for shelter and food and just like the rest of our population. And I think it totally relates everything to what you're doing and to how, they made a good choice when they put that program together for your medical school, because they found people like yourself who are going to go and do service in the world and not just be doctors and think about the science of it, but to be social action, movers and shakers. And I think it all ties back.
I'm going to have to send this recording to the Dean of Admissions at Mount Sinai Medical School.
I think you should. I mean, it's incredible. I mean, in your family, I mean, and Sam, your husband, I mean, you're all in medical in some way, trying to help people, trying to figure out a way. And by the way, listen to the episode I had of Sam Glassenberg before. Really cool. But I think it's so important. And I think Erie is not an anomaly within Skokie or Evanston. It is a major part of it, but there are many different organizations that are like this. And it's just so important. And especially as we hopefully are coming out of this pandemic, it's important that people think about their health and know that there are options available to them that you may think, well, I don't have any money. Maybe I don't have a job, whatever it may be. You can go to Erie. You can get everything taken care of and you can be healthy. And it's much better for yourself and for society if you have these things addressed.
100%.
Yeah. Where's the next step where you think you're going to be going? I mean, what are there any, I mean, obviously it's whatever happens next and you go to it, but is it something that you plan for? So for the next crisis situation, from Erie, do you have something planned out? Is there an action plan?
You mean internationally?
Internationally, or if something comes to Chicago, do you guys have just like a set plan? Was it because overnight you had to go down there and help people? I mean, is that something that you just had like ready to go? Say, okay, we need these providers, we need this many providers, we need this equipment, let's go.
So sort of similar to what I was saying about how the Evanston Clinic itself operates, we have some tremendously talented operations team members at Erie. So the call came out from our chief medical officer. She really, quite literally, sent an email to all of the medical providers and said, who is available tomorrow between 12 and 4? Mm-hmm. People raised their hands, right? And people volunteered. And 3, she emailed those of us who it made sense based on who they thought was going to be coming and what skills we had and, the ages that we felt most comfortable managing. And we went down there. And similarly, the operations team, quickly grabbed the supplies that they needed. There's a list now that they have, right, that they've compiled. And they came into this welcome center and like a whirlwind, they had the place cleaned up. They had all the different, we call them exam rooms, but they were exam cubicles that they set up, right, with sort of temporary dividers in this big room. The truth is, as I was sitting there and one of our seasoned medical assistants was taking vital signs and directing traffic, I thought to myself, we need to get these people to Poland. They were so efficient and so impressive. And just, I sat there and in an hour and a half, 2 doctors dealt with 60 people.
Wow.
Because they just shuffled them into us and we were able to address the things that they needed to have addressed. So there is a robust team at Erie that is able to stand up and manage these kinds of issues when they come up. So I feel confident that if, various southern border governors continue to inhumanely bus people to other parts of the country without making appropriate plans for it ahead of time, that places like Chicago will be able to continue to accept, greet, welcome those people with open arms and make sure their needs are met.
It's amazing. It's like Erie's Doctors Without Borders, team.
Yeah.
You can just send, to wherever it's needed. It's truly impressive. And I think it's, just such a testament to this community that it exists here. And thankful for it and grateful that you're, leading it in many ways.
Thank you.
You're welcome. So if people want to learn more, where should they go? So should they go to the website or should they just go into the clinic or what do you think?
Oh, you mean about Erie specifically?
Yeah, for Erie.
I think starting on the website would be a great option because we do have We do have clinics outside of Skokie and Evanston, and I'm sure with your wide listenership, there are people who aren't right here.
Sure.
So that's the best place to find where your closest clinic is. And then there's a number to call if people want to become a new patient or have questions. And even if people need help applying for insurance, we have trained insurance navigators at each of our clinics and available over the phone who can help guide people through that process.
And if you want to learn more, go to eriefamilyhealth.org. I'll have a link to it in the show notes, so you could get to it pretty easily. But it's great. Judith, thank you so much for joining me today. I appreciate it.
Thank you for having me.
Hi, I'm Aaron Masliansky, longtime Skokie and Evanston resident, host of Inside the Skev, and local real estate expert. As a community connector and realtor with Dreamtown Realty in downtown Evanston, I know firsthand what makes the Skev such an amazing place to live. When I'm helping my clients buy and sell properties inside of the Skev or out, I'm doing it with the best technology and support team behind me at Dreamtown. During the pandemic, I've been able to help my clients seamlessly stay on track with their home search. From immersive 3D Matterport tours, professional photos, to virtual open houses, my clients can find their homes safely and comfortably, and even from their couch. When you're ready to make a move, know that I'll be here to help. You can always find out more about me at skevinston.com/real estate. Again, that's skevinston.com/real estate, or email me at aaron@skevinston.com.